Hi, everybody. Thanks so much for joining me today to talk about a really exciting and important project here in Georgia. And I have with me today to talk about this project is Greta O'Dell from River Edge in the Macon area. And welcome, Greta.
Thank you for having me this morning.
Well, it's my pleasure, and the project that you're working on is so important to the state, and I want folks to know that if you have an adult or that you are caring for with intellectual and developmental disabilities, you really want to listen to this interview today, and I promise we're going to try to keep it on the shorter side, okay? But here in Georgia, we have a new Crisis Stabilization and Diagnostic Center that is being built in the Macon area. And River Edge is overseeing this project. So Greta, can you start by telling us a little bit about how the new facility, how did it come about, and the role of River Edge?
Yeah, so it's probably been about 4 years ago. There was some discussions at the state level about just kind of really shoring up the crisis services. They felt that there was a missing link in the continuum to be able to provide services for IDD individuals in crisis. Very difficult for dually diagnosed individuals to receive the psychiatric care that they need with all the changes that are kind of happening in the state. So state legislation set aside some money for the project on an annual basis to build and operate the Crisis Services and Diagnostic Center. It's being developed to serve that gap in that crisis continuum that I was talking about. This facility is going to be the highest level of support for adults with intellectual and developmental disabilities. River Edge is going to operate the actual crisis services portion of the programming. Will support up to 16 adults with intellectual and developmental disabilities or a co-occurring or intellectual disability and behavioral health diagnosis who are experiencing those psychiatric or serious emotional behavioral changes that leads to disruption of them being able to stay in that natural home setting.
And so what ages you talk about adults? So is that 18? Are we talking 18 and older?
Correct. 18 and older. Yes.
Okay, great. And so is this, I know that there's an issue, we all know that there's an issue with individuals being stuck in ERs. So this is another potential solution for that as well, correct?
That is correct. What we will, the department is going to determine who will receive priority to be admitted. But my understanding is that this is one of the programs that's being put in place to be able to divert those individuals from going to an emergency room and sitting for services.
Okay, excellent. So, and will this facility, will it serve people statewide or only in that Macon area?
So the entire state. Okay. And I'm probably getting a little bit ahead of you, but just to kind of help explain. So we will serve the entire state. Referrals will come through GCAL or the current crisis system. And all admissions will have to be approved through DB. And so somebody couldn't contact me directly and say that they wanted to be admitted. All of those referrals, GCAL will make the referral to DBHDD, and DBHDD will send us the information.
Okay, so let me see if I've got this straight. The referrals will all come from GCAL. So they cannot come from, say, a private doctor in the Atlanta area, or it has to come through GCAL. So families would need to call the mobile crisis, Georgia Crisis Access Line. Yes. And yes, they would make the referral. Okay.
That's correct. All of the details haven't been worked out yet, but I know that in the way the current crisis system functions is there are some times that DBHCD gets involved with an individual through regional offices or support coordination or planning nurse administrators when things are not going the best for the individual. And so DBHCD will be able to directly refer to us without it going through GCAL. But the quickest way will be to access through 988 or calling the 888 number with GCAL.
Okay, great. So and the facility is going to have inpatient and outpatient services, correct? And so in terms of medical, there's going to be medical services offered, which is quite exceptional, right? In Georgia, and from what I'm hearing, also in the country.
Yep. So we will, so Mercer University is on board and partnering with us and the department to provide services. And we're setting it up, the different medical services to be offered are going to be dentistry. We have a 4-pod dentist office that's there for cleanings, extractions, assessment, neurology. We have physical therapy and occupational therapy, endocrinology, ophthalmology, audiology, having a sound booth there. We'll also have speech and language there. Mammograms, we'll have a mammogram machine there, as well as x-rays for just kind of routine x-rays, or someone comes in complaining of their arm, shoulder, we'll be able to do x-rays to see if that's what's causing the behaviors, podiatry, OB, GYN, all the, but still all the exam rooms will be where any physician can really go in and use it to whatever their specialty is. Okay,
so the relationship with Mercer Medical, what will that look like? So are there going to be doctors there on staff, or do they come in periodically, or do we know what that will look like?
So we're still in the planning phases, but I do know Mercer is hiring a full-time physician. I'm really excited about him. I can't release his name yet because Mercer's still working through their contract. But he is a parent of a teenager who is autistic. And so he is very familiar with the support needs that are required in supporting someone who doesn't communicate the way someone without a disability does. So he's going to be their medical director. I've met with him several times. He's extremely excited. He's been in the meeting since the very beginning, even before Mercer came on board to the project. He attended a couple of meetings. So he will basically run the outpatient portion of the clinic. Everyone that is receiving crisis services in one of the 16 beds will receive whatever medical care they need through the clinic. We will have on staff a full-time psychiatrist as well as a full-time APRN that's working on the crisis services side. And they and the behavioral staff will work with the medical director to make those referrals over, get the appointments, have those individuals seen. But also, Mercer will run it as an outpatient clinic that anybody can come to and make those appointments. As soon as all of those processes are worked out, I'll be glad to kind of hook you up with that medical director so you can get some more information closer to opening to know how families can actually, if they live in another part of the state, how can they actually access those outpatient clinical services.
That's wonderful. I would appreciate that. So getting back to the GCAL and the mobile crisis unit, they'll have the authority to make the referral. And will transportation be provided for those? Yeah.
Yeah, yeah. So haven't completely worked all those details out. I
Okay.
would imagine that if somebody is in a emergency department, then yes, we would be able to easily work out that transportation. I still don't know all the details around if somebody's being served by the mobile crisis team, like in-home support, and it was determined that they needed that higher level of care. Would mobile crisis support them, or would we need to send someone to get them? All of those kind of processes haven't been worked out yet. But somebody definitely, if they were being supported in a home or in another part of the state by a now or comp provider, I would see that that provider should be responsible to bring them to receive the additional care. Does that make sense?
I think so. And
Yeah.
so, is there a mechanism in place yet for who will receive priority in being admitted, or have you all developed those policies yet?
So still working on policies. We do
Okay.
have the first draft of the department standards that we're kind of working through. I feel like the department knows who are going to receive the priority. It's really going to be those individuals that I think have been stuck in emergency rooms or in emergency departments. Those individuals that are going in and out of the crisis system, and we really just can't figure out what is causing those behaviors. Because the hope is that they get the appropriate medical care along with a really good intensive functional assessment for us to figure out what is the root cause of those behaviors, and then we can support the families and staff who are supporting them on a daily basis so they can return to that natural setting.
Okay. So I had a mom reach out and ask, well, this was an interesting question. There's a challenge when individuals with IDD need medication changes, right? So whether it's taking them off of a medication completely or introducing some new ones. So if someone needs that in-hospital support for the medication changes, is that something that might be available?
I would expect yes. It is very common for individuals to kind of need maybe what we would call a medication holiday in order for us to kind of reset and maybe take somebody's been taking tons and tons of medications, taking them all off of them and then just adding them back slowly at a time. All of that could be covered through kind of those psychiatric assessments and needs. Again, they would have to go through the department to get that referral, but I would guess that if a psychiatric provider was working with someone and felt like that's what was needed, we will eventually have a process of who it is they would need to contact at the state office that they could make those arrangements.
Okay. And you're still in the construction process, right?
We are.
Yeah, you are. So you may be able to answer some of these, and also the policy making process or the policy developing process. But just some of the basics, will it be accessible for wheelchair users?
Absolutely.
Okay.
Absolutely. So the 16 beds on the crisis services side, the 16 beds, all of the rooms are accessible. The entire facility is accessible, but we will have 4 rooms that traditionally in a crisis stabilization type setting. Of course, everyone knows IDD individuals usually aren't supported in those sites, but especially our individuals that have higher medical acuity, CPAP machines, maybe oxygen, other things. Rooms in crisis stabilization facilities do not have electrical outlets and all. just for the safety features of that. We will have a pod. It will have 4 bedrooms that will be able to support individuals that have higher medical acuity. Hospital beds will be in those 4 rooms. That's the nursing staff will be able to raise and lower, and also those individuals that maybe have cerebral palsy who need a bed that can be shaped more to their body to support them, we'll be able to do that at that facility. So, and then on the outpatient clinic side, of course, it is also accessible. And we're even making it accessible for individuals that may need to come in on a gurney or in through an ambulance or something, but just needs that outpatient care. There'll be a way that they can enter in through the rear of the building, straight in onto the medical side, and not have to come through the entire building to attend an appointment.
Okay, that's great. So also thinking about the environmental modifications for people who have autism or other sensory sensitivities. Will there be noise machines, dimming lights, those type of things, those environmental supports for our folks?
So I'm really excited about, 2 of the things that we have that we're in communication with the sensor, Jay Perkins, who is over, I think his business is called Sensory Systems, I think, out of Atlanta. He puts a lot of sensory rooms in school systems. He is actually, we're working with him, we've contracted with him, and so we will have 2 different sensory rooms, one on kind of each side of the treatment area, that individuals will be able to have free access to go in. There'll be all kinds of different sensory things, but of course, dimming lights, sound machines. We'll also have some tubing that hangs from the ceiling, some wall functions, different seating, so that way we can really kind of help individuals. We're also have 2 calming rooms that are separate from those. Our intent is we will not be using seclusion and restraint just because of all the trauma that comes with that. But we do have 2 calming rooms that individuals can go into if they need some additional time to calm down. They're real upset. And so each of those rooms, one will have, it will be untraditional seclusion furniture that's in there. One will have what's called a boat and rocker by Pineapple. It's like getting a really big hug when you sit in it. It's a really cool product. An individual can sit in it, can sit still, or it has a slight tilt on the bottom and you can rock a little bit. And then the other room, we're going to have a recliner in. It's a ligature resistant recliner, but really hoping that these rooms aren't institutional looking, but can provide staff will of course stand outside those rooms, but we'll also have a wardrobe of sensory items that are there that as the individual wants additional items, weighted blankets, fidget toys, sound machines, those kinds of things, they can have those items and it be in that area, and then they can return to the regular unit whenever they feel comfortable and want to do that.
What about individuals who are, that all sounds really fascinating and wonderful and very thoughtful. What about individuals who are nonverbal? Will they be able to be a part of, if they need to be admitted? Are there special supports for these folks? What might that look like?
So
Do we know yet?
So we're still working through a lot of that, but all of our staff will provide services through that positive behavior support model. So all of the staff are trained on how to work with individuals no matter their communication needs, being able to offer them choices, looking for those physical or body cues in order knowing what the individual's interested in, not interested in. And so we will also, as part of kind of the intake process, be meeting with the individuals and their support staff or families to kind of do some, like a health checklist and all about me and learning about their self-preservation skills and all. So that way we can really support them while they're there, and also know maybe what areas that we could provide some additional support in, and maybe teach the individual some different things also. Does that answer your question?
Yes, it does. So would there be any opportunity for an AT eval, assistive technology eval, for individuals who maybe are nonverbal? Is that something that would be a part of this model?
Sure. And then we will also kind of make those referrals either through, if somebody is on the waiver, through the support coordinator to try to get dollars attached if they don't have dollars to be able to assist in purchasing things that have been identified. We also will have full-time BCBAs on staff as well as RBTs in order to really kind of help with teaching the staff as well as the individuals better ways to communicate and for staff to understand when the individuals are communicating with them in a way that we wouldn't necessarily usually see it as communication. So.
Okay. And then what do you anticipate? Again, you're developing policies now, et cetera. What would be the longest stay? So this facility is meant to be short term, right?
It is
not meant to be a long term.
That's
facility.
correct.
Okay.
So maximum stay is 90 days.
Okay.
And of course, all of that will be determined based on all the comorbidities. You know, somebody maybe who has a lot more medical stuff going on may actually stay there for the whole 90 days. But one of the reasons why we're the clinic's also going to operate as outpatient is so we don't keep someone there that has been determined is ready to go back to that natural setting, but maybe has a dentist appointment or needs some additional work, dental work, or additional medical care. They won't have to stay in the facility to get that. They can go to their facility and then come back for those appointments.
Okay. And then the discharge. So what would that look like? And would waiver eligibility for folks who don't have waivers, would that also be a part of this process?
Yep, hope so.
Yeah.
So the plan would be, so we'll have a full-time clinician, a licensed staff that will also kind of do the case management. So at day one, when the individual is admitted, they will kind of start talking with who's involved with the individual. They'll be a part of all of that. What's important to that person? Do they want to go back to where they were living and they need some additional supports there, or do they need a different living environment because they weren't getting the support needs that they required? And so that case manager would work with the planning list administrators or support coordinators to start that process from day one, so we kind of can work through what are those barriers.
Okay. And for the outpatient, would the facility accept Medicaid for outpatient?
Yes.
Okay. Okay.
They will.
And then, and this is so exciting, and I promised you 30 minutes and we're at 29 minutes or so. So my last question to you is, how can families with lived experience who have support adults with IDD and co-occurring conditions, how can we help you? How can we help the system be stronger? Is there anything we can do?
Yeah. Well, I mean, I think that as we grow this program from infancy, the first year is going to be a lot of learning. And so if families have end up using this facility and they notice something should be done differently or something would be more helpful to them, really the families being kind of honest in what it is that they need, so we can look at what is it we need to do differently. My hope really is that when the individuals come there, that we really can identify what would make the individual most successful, and not have to come back into the crisis system and give parents, families, other providers around the state the resources they need in order to maintain them. And those resources may just be a phone call. One of the things that I'm really excited about is the facility is going to be a teaching facility on the working with our psychiatrists. We will have residents coming through that will learn skills in supporting individuals that have an intellectual and developmental disability. And when they finish their residency in the Macon area, whatever part of Georgia that they go to, they'll have those skills and be able to support individuals around the state. And our plans on doing that same model over on the medical side. They will have medical residents in all of the different specialties kind of rotating through their facility, working with the physicians. So I talked about they will have a full-time medical director and some full-time nursing staff, but there will not be full-time specialists there. Mercer will actually contract with specialists around Middle Georgia area that will come in for clinics. And so today may be a podiatry day, and tomorrow may be we're doing mammograms. And so they will set up kind of a clinic type way that individuals would be able to come in. But during those times, physicians who will then go around the state of Georgia, everyone knows Mercer's mission is kind of rural healthcare and increasing that around the state. And all of your parents know, especially in really rural areas, it's hard to get good medical care. And so it'll take a little while to build that network, but I'm really excited that in the future, we will have physicians around the state of Georgia that will feel comfortable in supporting an individual that has higher needs.
Excellent, excellent. So the anticipated opening date, is that next March-ish?
It is. It's March
2025?
2025. Yeah.
Okay. All right. And may we check in with you again as we get closer to that?
Absolutely.
Okay.
And once I get the go ahead with the medical director and all, I'll be glad to share his information, and maybe I can bring him on with me, so y'all can ask him some questions as well.
Wonderful. Thank you so much, Greta O'Dell. Best of success to you, and I appreciate your time today.
All right.